Hello there, I'm Dr. Ali, the entrepreneurial women's menopause doctor, and I help women to escape from the hormone prison so that they can live their life with ease. And today I'm just going to do a little delayed live. We're going to talk a little bit about breast health and breast cancer, because October was Breast Cancer Awareness Month, and breast cancer is really common. It affects 1 in 12 of us in our lifetime, and the older we get, the more likely it is to happen. And there are some links with hormones and cancer. And so it's important to know what to inform yourself and to have some idea of what you can do to offset that. So first of all, I'm just going to talk about some of the things that I recommend to help reduce your risk of breast cancer. It may be that you have a family history of breast cancer. That only really makes a difference if you have family members who develop breast cancer under the age of 40. So if it's older than that, unless there really are very many, then it's less of a problem. My sister developed breast cancer when she was 34, but that was just spurious. We don't have any other cases in the family. So I'm not at particularly high risk from that point of view. But I do have a friend who has the BRCA gene, and that makes certain decisions very difficult. And she opted to have a bilateral mastectomy to reduce her risk of breast cancer. So there are situations where it's wise to get yourself referred to a genetic counselor, genetic services, and there are specialist breast cancer genetic services that have sprung up across the country now. So one of the main things that you can do to reduce your risk of breast cancer is to maintain a healthy weight. Obesity increases your risk of breast cancer more than anything, more than HRT, more than being on the pill, more than anything else. And so, and obesity is really common. As we are surrounded by more people who are overweight, then it becomes more acceptable in our mind's eye, even though we may feel less comfortable than we do when we are at our best weight, at our optimal weight. So do your best to maintain a healthy weight, and be aware when you're looking at that your emotional eating may be a part of your weight situation. So it's worth joining my Sexy Fit program, which started last Saturday. You can do it, you can follow it as a self-study, or you can follow it with the next group in January. And with that, we're encouraging you to journal about what's going through your mind when you do eat, and how you're feeling as you're going through the initial 5-day reset, for example. But do your best to maintain a healthy weight. And time and again, I hear women saying, oh, I can't exercise because of pain. There's always some exercise you can do, even if it's just picking up a can of soup and doing some weights while you're seated. Do that a few times and you can feel it affecting your muscles, and that's going to help with reducing weight gain. Exercise is key. Nutrition is key, both the macronutrients and the micronutrients, which we're going to come to later. You need to reduce your chemical exposure to reduce your risk of breast cancer and other cancers. So smoking increases the risk of breast cancer, as it does other cancers, but so do other pesticides. So if you work exposed to chemicals, then make sure you wear some form of mask. That includes cleaning chemicals. And many women are doing cleaning jobs, especially as they're getting older and they want to ease back from maybe a more pressurized job that they had when they were younger. But do be aware of the chemicals you're exposed to. And this also includes the chemicals you may use in your own home when you're cleaning. So I recommend that you have you try and aim for a natural products when you're cleaning the house. So I tend to use in the UK a brand called Method. We did try Ecover, which was the first natural brand to come out. But that doesn't clean as well as Method. So do have a look around, see what's available in your country, and see what's available to you. Lemon juice is a great cleaner. So there are also natural things like lemon juice and bicarbonate of soda. So
do a little bit of research, and essential oils are also really helpful when you're cleaning. Eat foods as close to their natural state as possible. So processed foods are will promote obesity, and also they may impact the cells of the breast and increase the risk of breast cancer. So eat foods as natural as possible. Make yourself salads, make yourself steamed vegetables, and where possible, grow your own or buy organic. Again, this will reduce your chemical exposure. Why are chemicals important in breast cancer? Well, many chemicals have xenoestrogen properties, and that means that they may stimulate the estrogen receptors in an adverse way. And very often that will increase the risk of breast cancer. I will also recommend that you supplement with advanced cellular nutrition to improve your cell's metabolic pathways. And this will improve your cell's ability to regenerate effectively. It will reduce the chances of your cells regenerating in a bad way and increasing cancer cells. And this can all help to reduce the cancer cells circulating in your body. Incidentally, we do produce cancer cells every day. Cancer cells are produced in your body every single day. It's the role of your immune system to mop these up. And I recommend advanced cellular nutrition to enable your cells to work properly in that respect. And advanced cellular nutrition does improve your immune system and your immunity. It's also worth knowing your genes. Now, if you're somebody who's like to get very anxious, if you know your genetic makeup, then by all means avoid doing this. But if you get these checked with a plan in place with a good functional medicine practitioner who's been educated in nutrigenomics and the way that we can impact our genes and we can adjust our lifestyle to impact the effect of our genes, then it doesn't need to be a scary process. How much better informed are you if you know your genetic makeup and you know that in natural fact to reduce your risk of breast cancer, you personally need to have a particular type of folate or B12 supplement in higher levels than the next person. It's empowering, believe me. In addition, I recommend a Dutch test. This is my go-to test in my private medical practice, my hormone balance practice, my menopause practice, and in my online programs where I show people how these work. So I'm just going to show you my Dutch test and explain to you why it is that it's so powerful in this respect. There we go. Right. So here you see my Dutch test from 2016. And what this shows is it shows you what's happening with your hormones, not only your balance of different estrogens and progesterone, but also it will show you the way your estrogens are being metabolized. And this is crucial in assessing your risk of breast cancer and reducing that risk. So there are three estrogens: estrone, estrone or E1, estradiol or E2, and estriol or E3. Now, estrone is the highest risk of the estrogens, and it is the one that is most prevalent after the menopause because it's produced in the adrenal glands. So this is the amount of estrone is crucial. The reason it's higher risk is because it stimulates the proliferative receptors, the receptors that encourage breast proliferation. Very, very important when you're going through puberty, when you want your breasts to proliferate, but less good when you are menopausal, postmenopausal, and you want to reduce that risk. Estradiol stimulates both the alpha and beta receptors equally, and estriol, which it's less effective for things like your hot flashes, but on the other hand, it's stimulating the protective receptors, the beta receptors, rather than the alpha receptors. And so this has a good effect if you have a balance of these. And that's why when I prescribe bioidentical hormone replacement therapy, I use a combination of estradiol and estriol, with most of it being estriol. And that combination, the ratio, depends on your individual needs. Going on to the way it's metabolized, this is an average person's or normal estrogen metabolism, where you're getting mainly this subtype, the 2-hydroxy metabolite, and this is a healthy one. What you want is the minimum possible of the red one, which is the 4-hydroxy metabolite, which, as you see here, here's the red arrow. In my case, I have 2 high levels of it, or had in 2016. And this shows that it can actually damage the DNA, because if it's not methylated, the 4-hydroxy can bind to and then damage DNA. And it's damaged DNA that causes cancer. So we want to optimize our estrogen metabolism, which we can do by various techniques, various supplements, and also by supporting the liver. And we also need to support the liver in deactivating these metabolites through these pathways here. So that is a little whistle-stop tour of the Dutch test, which is, well, as I say, my go-to test for helping people to understand their hormones, which is my key. I really want women to understand what's going on with their hormones, so that they are more empowered, and they're not just being told what to do or being told to go away by their doctor, because they have that knowledge, but also they have that independence, because that knowledge helps them to really understand why they need to take steps like losing weight, for example. That empowers you, that gives you more motivation to take the steps needed. And then finally, I recommend that you support your liver detoxification protocols with a product that supports the liver, such as the Hepasil DTX that I use with my clients. And that helps your phase 2 detoxification process. So the liver goes through, the metabolites go through 2 phases, phase 1 and phase 2 in the liver. And we really underestimate the importance of our liver in our metabolism, and the way we process and get rid of chemicals, hormones, any proteins in the body. The liver is crucial for this, and it also crucial for making many of your hormones more active as well. So really important organ, the liver. Very understated. Okay, so that's what we're going to talk about today, and I hope you enjoyed that. If you've got any questions, do post them in the chat beneath this. I don't know yet whether Facebook's going to ban it for 7 days. It usually does, which would be a pity, but hey ho, such is life. Okay, so I'm Dr. Ali, the Entrepreneurial Women's Menopause Doctor, and I help women to break free from the hormone prison. Take care.